This talk is about defining the scope, defining what skin clinic is, and defining what spa is, and also a cosmetic skin clinic. It's important that we define the scope because it helps us to brand, and also from there, we talked about the two pathways. Once we understand what we are trying to do, the path becomes a lot clearer. So for the definition, before we continue to discuss more complicated matters, let's define several things: the spa clinic, the skin clinic, and medical cosmetic clinic. So the demarcation is not clear. It's only used as a guideline. For example, when I talk about spa-ish, in fact, I seldom use that term. It involves the skincare, peels, facials, LED, and perhaps microneedling. You can see that it doesn't have to cater for the medical aesthetics, and then you have to define what medical aesthetics mean. Because by and large, a lot of the volume and business is actually in this area. It's actually skin peel, skincare, facials, LED, and so on. So I call this a spa, this is almost the minimum standard that one need to incorporate into any skin clinic. So the next one is, what is a skin clinic? Well, it's a step up from the spa in the sense that it does require some degree of machinery. So there is a bit of capital investment and a higher degree of knowledge. And addressing this series, I'm not going to touch on medical cosmetic skin clinic, which means that it involves things like cosmetic mold removal and a lot more medical knowledge that is required. And of course, within any of these three models, one could incorporate anti-wrinkle or filler injections. And if your clinic allows you, if you've got that degree of medical knowledge, you can consider treating complicated conditions like melasma. But for the purpose of this series, I'm going to leave out the medical treatments. So we're not going to talk about medical cosmetic clinic. We're only going to talk about spa and the skin clinic, because by and large, this is a much easier area to without special knowledge. So almost everyone needs to know. And if one is a medical director of a medical cosmetic clinic, do they need to know this? Absolutely, because these treatments may not be performed by the doctors, and will be performed by the team. As mentioned, within the scope, we are going to talk about spa and skin clinic in one. I'm not going to refer to this anymore. I'm just going to say skin clinic. But before we progress, spa involves in indulgence, comfort, prevention, and maintenance. That is what it is. Skin clinic involves mainly in rejuvenation and in anti-aging. So there will be some degree of correction. And this is, as mentioned, by far the biggest market share rather than cosmetic mold removal or thread lifts or something. And if you can form a business idea, whether you are a business owner or medical director or a beauty therapist, this helps you to shape what exactly the scope, and in fact, it helps with you with the branding. What are you trying to achieve? So in your mind, you need to be very clear from the outset what direction you are going into. Again, repeating myself, it doesn't mean you cannot subcontract a doctor to do the more advanced treatment, but it has to do with your branding, right? Because you're going to have to spend money on marketing, and you're not going to depending on where your revenue is, you're not going to like suddenly advertise a thread lift when you're basically a skin clinic, because you have to waste a lot of time and energy to market that area, to market the service. We will definitely address that in our business stream. But for now, you need to be clear what I'm talking about. Where to from here? Well, this is continuing the discussion. It is the beginning of a series. And for those who are specialists in cosmetic dermatology, please visit our website.